joined with the CEO of HempFusion, Dr. Jason Mitchell. Happy New Year to you.
Happy New Year to you as well. Thanks for having me.
How was great to have you on. How was the holiday season for you?
The holiday season was good. It was a little different. Obviously, my family and I, we've agreed to put an asterisk by 2020.
Yeah.
We've decided that it's weird, it's not normal, and then we're just going to sign it off. And it's somehow, we don't even have pictures. We didn't send out cards this year. We didn't do all the normal things that we do because, quite frankly, we didn't get together as a family. So
yeah,
we're going to keep that one as an asterisk and say, remember when.
Yeah. Well,
we're just glad to put it behind us.
You're probably not the only family that's doing that this year. That's for sure. So where are you based out of in the U.S.?
I actually live in Tampa, Florida.
Okay.
So I like to keep it warm.
Yeah. Well, good time of year to be in Tampa, that's for sure. But
100%.
anyways, I want to talk about, have you on again. We've had a couple of the people on before, but most importantly, you're the CEO, obviously, of HempFusion. Big day, obviously, coming up later this week, uplisting on the TSX on Wednesday. But before I get into the whole business side of things, I think it's very vital and important that we hear about your story specifically and personally, because from what I understand, you were originally against cannabis. And in the beginning, as far as looking at it as a viable alternative to synthetic medication. So let me find out, what turned you around to the point where you're now a CEO in the space?
Well, it's a really good question. And I actually love sharing it because, quite frankly, I got motivated by something very unique, and I'll explain. In 2011, I was the chief science officer for a company called Country Life Vitamins. I developed hundreds of their products, and I was there through their acquisition by Kikkoman Foods and so forth in 2006, stayed on until about 2013. But in 2011, I became very ill. I was ill with something called ulcerative colitis. It's an inflammatory disease of the lower digestive tract. Now, I want to be clear. I'm not suggesting that somehow I'm now the CEO of HempFusion because somehow hemp cured me, because that's not at all what happened. I wish that was the easy way you could say it, right? I had to have the traditional medical intervention and all the things that would normally come with this particular disease. And this disease is awful. And it comes with a lot of pain. It comes with a lot of suffering. There's a lot of challenges. Very few medications actually work. It's just all around challenging and can be very debilitating.
Right.
So I think a lot of people in that circumstance either find themselves bottoming out and just giving up, or they stand up and do something about it. And so in 2011, when this happened to me, the therapies that were offered to me were scary. Some of the side effects were worse than what I was dealing with. And I'm like, this is not okay.
And that's 10 years ago.
Now, I'm a board certified naturopathic doctor, so I have a much more natural approach to things. However, I will say the collaborative element on the natural side versus the allopathic or the normal traditional doctor side, I think is a really important junction. I think these two need to come together as opposed to be diametrically opposed. I just don't think that's right. I think they need to come together more often because I think more resolution will happen. But anyway, I was extremely anti-cannabis. And in fact, if somebody told me that cannabis or marijuana or hemp would somehow have helped me back then, I would have rejected them almost as rabidly as you possibly could imagine. I mean, literally almost like having a political duel, right? I mean, it would just have been terrible. And it was really funny. Through just a little bit of research, though, I got introduced to a terpene, believe it or not, called beta-caryophyllene, which had some really interesting research. It is found in cannabis, but it's also found in spices like clove and black pepper and so on. And then from this terpene, I ended up learning about the endocannabinoid system. And see, when I was in naturopathic medical school, they didn't have study on the endocannabinoid system because it's still a relatively new finding in the scientific community. But it was really quite special when I started to understand, oh my gosh, there's this amazing system in the body. And were those people right about what they were saying about cannabis? And so almost apologetically, I was led down the path to become a founder of a company called HempFusion. I mean, I first, though, started off with Probulin, our probiotic company, which is wholly owned subsidiary of HempFusion. But I started off with Probulin because it was probiotics. It was more in the lines of what I understood. I was, my background in microbiology and immunology and stuff like that is a very strong, focus of mine. I've become a learned person on the endocannabinoid system differently than what traditionally would happen in medical school or something. And so for me, I had to learn it differently. But man, starting HempFusion was almost apologizing to all the people that I probably said the wrong things to about the cannabis industry. And so, I mean, if any of them are listening here too, I apologize that I was such a jerk, because I was wrong. I was completely wrong. And I think that out of that came the most intimate involvement on how can we do something amazing.
You're right.
And so that's really what drove all the innovation what drove all the creation of the formulas and the thought leadership behind how are we going to get the very best products on the market. It also drove a lot to do with quality,
Right.
because I believe that our most important asset is our consumer. And
Right.
if that's the case, then their safety should be the most important concern too.
Yeah, of course.
So,
Good point. How much do you feel the perception, like in addition to your story and how you change, but how much do you feel the perception of cannabis and CBD is changing rapidly across the US?
well, along the same time frame when I was rapidly against it, I would say there was a good majority of people that were in the same boat. And I would say that most of them are just, um, they were wholly ignorant of the subject matter.
Yeah.
They just hadn't learned about it. They didn't have enough information. And so much of the programming that happened very young in my life was, you know, say no to drugs and
Yep.
here's your brain on drugs and so forth. And all these things that,
Anti-Reagan
and
era.
they equated marijuana and hemp as one of those things, which now obviously we know is just 100% not the case,
Yeah.
especially in the area of hemp. And so I would say the perception has dramatically changed because I think people are kind of sick and tired of being sick and tired.
Yep.
And they want alternatives. They want something that can help them in a way that they feel good about, as opposed to this is the only option you have.
Mm-hmm.
No, and I really don't think that's the right way to approach medicine. And see, I believe that medicine is about 50% placebo. And I know that sounds like a really terrible thing to say, but I think if you believe it, then it's probably more likely to work.
Right.
But when people question the mere therapies they're taking, that in itself may drive a little bit of non-compliance or an inability for a particular therapy to work. But when something like hemp comes along and there's so much promise within it and so much research happening, when you can open up the door in the eyes of someone to say, you mean to tell me there's something that's potentially safe and that potentially has an answer, I'm all ears.
Yeah.
And I think the perception is quickly changing. And I'm actually excited to see the steps that it's taking right now. It's actually happening in such a rapid rate, faster than I've ever seen in any particular area.
Yeah, in multiple industries too.
Yeah.
You're coming into 2021 with a major expansion into the food, drug, mass retail space. You're already in 4,000 retailers.
Yes.
So the potential for growth here in the coming year is significant when you look at obviously the regulatory requirements are for getting in the door for large retail spaces. So you're already in. That gives you a major distinction and advantage going forward over others in the space. So explain to my viewers as to why that is so crucial.
Well, when you look at the retail community as a whole, I understand that over the past year, you've seen a market rise in online purchases, and I understand that.
Mm-hmm.
But I'm going to tell you that once the door opens back again in a secure way where people feel comfortable and safe, you're going to see such a massive twist right back to physical retail, because there's that intimacy of holding the product before you buy it, and learning about it, reading it, flipping the bottle around, just having that interaction, being able to ask a pharmacist or a store personnel, what do you think about this? And having real-time interaction, I think people are just craving. The food, drug, and mass retailers, they are the ones that have the largest foot traffic. And they're the ones that have the largest exposure to such a massive audience of individuals that there comes a sense of credibility with certain banners. Like, let's say, the Publix of the world, the Albertsons, the Krogers, the Targets, the Walmarts, the big retailers that have credibility. When you can be a brand associated with doing businesses and retailers like that, you automatically gain some sense of credibility with consumers. Now, because these retailers have such a strong vetting process, their consumers have learned to trust them.
Yeah.
And so having that type of exposure is incredibly meaningful. And it's something important to us because we are an incredibly credible organization. Now, not to hype us, but we focused on building a regulatory portfolio that we believe is second to no one. And making sure that while others were focused solely on building their sales, we focused on what the next steps are going to be. Because that initial phase in hemp and CBD was really exciting for a minute. But it's the endurance foot race that's going to happen starting now over the next several years that's going to be the most meaningful and have the largest impact to hemp-derived CBD.
When you think about CBD and the regulatory framework that's been around it, a little bit of a roller coaster ride over the last couple of years. And it's probably because there's a lot of companies that don't meet the regulatory framework. However, HempFusion, you're a company that actually is part of the Hemp Roundtable Authority. So that gives you a finger on the pulse when it comes to properly, regulating the market. So you hear things every single day from the FDA, the average investor wouldn't. So what are some of the things that, the FDA currently stands on with regards to regulation? And what does that timeline, I guess, look like going forward?
So what I can tell you is that we are a multi-year contributor and involved in the U.S. Hemp Roundtable, right? And the U.S. Hemp Roundtable was one of the instrumental advocate associations for hemp in helping to drive the completion of the passing of the Farm Bill in 2018. And so very influential organization. And for those that don't know the U.S. Hemp Roundtable, get to know them. They have good information. You definitely want to interact with them. I would tell you what we're hearing is this, is that I believe that the FDA is opining on three primary areas. One, they're trying to define whether or not what is offered as a dietary supplement is a direct conflict with what is already being sold as a drug. And that would be GW Pharmaceuticals, Epidiolex. But anyway, and that's called the IND preclusion, right?
Right.
It basically states that something that is sold as a drug cannot also be sold as a dietary supplement. So they're trying to figure out, are the product offerings on the marketplace too close, and are they considered a drug, and should they be, or are they a dietary supplement? The second is about quality and making sure that people are doing the appropriate testing, such as for heavy metals, micros, lead, and stuff like that. Just all the different things that some might take for granted and some are wholly ignorant of, but are producing products and not even knowing they have these group requirements. And then the third, and what I consider the most important, the FDA is asking the question, are products that contain hemp-derived CBD safe? See, we as a company knew years before that we were even getting this information. I'd say 2.5, 3 years ago almost now, we started down the road on toxicology studies and safety studies to verify that what we're selling is proper and safe for the marketplace.
So what do we see, I guess, in retail stores? Like for some of the companies that are currently selling, product on shelves that, let's say, once the framework is put in play, will we start seeing product taken off of shelves?
What might happen is there'll be a discretionary enforcement level, which means up to a certain milligram level per serving. They might say, we're not going to worry about that, but anything beyond that's going to require ABC, whatever those requirements may be. But we believe that there is going to be some requirement for companies like ourselves to submit to the FDA something along the lines of what is called an NDI, or a new dietary ingredient submission. Now, I will tell you, there's going to be only a select few companies that are going to be equipped to be able to handle that.
Right.
Because you have to have done things like toxicology and safety studies, And not only have we done those toxicology and safety studies, we've also involved ourselves with Valid Care for human observational data around liver and reproductive toxicology that the FDA also requested. So there's some really important things that have to be done in order for you to be a reputable company. And I would tell you that there aren't going to be a lot of companies that'll be able to accomplish that.
Well, it's an exciting year. Obviously, you have a new administration coming in, obviously, later this month. The whole industry, as you mentioned earlier, everybody thought the floodgates would open with the Farm Bill. But do you not think this feels different this time, that we are going to see some big changes and a lot of momentum going into the overall landscape in 2021 for U.S. cannabis and hemp?
I think that there's a huge change that's about to happen.
Yeah.
Now, this is just my personal opinion, and I can only do it from the educated vantage point that I see right now, right? And the now, I'm not going to sit here and tell you that the FDA has said something so specific that I'm basing everything on it. Although every indication from big business, I'm talking about the largest of large organizations, are already starting to maneuver into a position of putting products into their marketplaces and how they're going to do it. And I think the interest level is growing because they see and understand better now what the landscape looks like. I believe that it's very encouraging that that Congress is in favor of changing some of the legal standpoints in and around the sale of hemp-derived CBD dietary supplements, and even going so far as around marijuana and so forth. Now, I think the marijuana side of things, I think, is going to be a little bit further out.
Yeah.
Personally, I think that might still be a challenge, but I think the states are handling that a little bit differently. But hemp-derived CBD, dietary supplements, and then after that, somewhere in the future, food and beverage that includes CBD, I think is starting to move in a direction where we'll have a great deal more clarity. I mean, we're very encouraged by the momentum that's coming right now. We know that Congress is what seems to be in very large favor of making those changes.
Well,
it'll come with criteria, it'll come with regulations, but
this has been great, great education on the overall framework, and obviously an incredible opportunity. You guys are going public, obviously, later this week. So best of luck, obviously, on the TSX. You're in over 4,000 retail stores currently in the U.S. right now. Part of the, obviously, the board with hemp, obviously, in the U.S., and the team that you've assembled are members of that as well. So it looks like a tremendous opportunity, and I wish you all the best going into 2021.
I really appreciate it. And thanks for having us. I know this is an interesting time. And so we're very excited about the months
Yeah.
to come and the years to come for sure. So thank you.
One day at a time, right?
Absolutely.
All right. Say hi to everybody in Tampa for me, and all the best in 2021.
Thank you so much. Same to you.
All right. Take care.